Scoliosis is not a curse. It's a deformity of the spine. That's when the spine bends from side to side and also twists. And you see it all over the world. You see it in whites, in blacks, in Asians, Americans, Africans, Europeans, and it occurs in about 1 to 2% in the general population. So when you have it, you're not cursed. Patients can be born with it, that's congenital, and the most part, they are seen in girls when they reach their growth spurt, like adolescents. And it's about 10-to-1 ratio, girls to boys. Boys also can get it. So when you have scoliosis, you don't hide the baby, you don't throw away the child, and you find treatment. The earlier you find help for the child, the better. Because as it gets worse, it can affect breathing, can affect heart function, and patients may not live their full life. So it's not a curse, it's a condition when the spine bends and it can be treated. There has been some genetic studies to implicate that scoliosis tends to run in families, and it is true. We don't have the specific gene like other diseases that we know have a genetic inheritance. But mothers who have scoliosis are more likely to have their daughters also develop scoliosis. But they can also skip generations. So I've seen cases where a child has scoliosis, but there's no one in the family with scoliosis. You go back 3 generations and maybe a grandmother had it. Then I've also seen families where a mother doesn't have scoliosis, but 3 of her daughters all have scoliosis. Yes, the crooked can be made straight. How straight you are depends on how severe your curve is. And to make a child who is crooked straight, you have to operate. Braces can help a child's curve improve, but that's if you get it very early, like age 2 or age 3, you can put someone in a cast or brace to straighten the spine. Since we don't see them so early, and they all usually come when it's quite advanced, you can get partial correction, which is much better than nothing, because the goal is to have the patient's curve arrested so it doesn't progress, and also to come out with a very level shoulder, level pelvis, so you're standing straight and not tilted to the side. And that means balance correction. So you can turn or change an 80-degree curve to say 35 or 40, and that's very good. To focus, our cases are more complex than the ones that I'm used to in America and the ones that other people treat in first world countries. The reason is because of the neglected cases that come from everywhere. These patients have been seen by their local doctors, but because of lack of facilities, expertise, and resources, and it's very labor intense to set up a facility to treat spinal deformities. You need facilities with advanced imaging, advanced technology like cell saver, spinal cord monitoring. You need good anesthesia to be able to take a patient through surgery for hours, like 8 hours. We're the only hospital in West Africa that can monitor the spinal cord throughout surgery and be able to tell if there's a change in the neurological function that requires intervention or reversal of a process. So we see the most complex spine deformities, and we're very, very pleased with the results that we get.